Have you ever thought about a hospital that's in a constant state of emergency? And I don't just mean in the ER, I mean in its day-to-day operations. Well, that's the reality for a lot of hospitals in India. Today, we're going to talk about a really important shift, moving away from that chaotic firefighting approach to a much smarter, proactive strategy of fireproofing the entire healthcare system. So this really is the core question, isn't it? Is a hospital just running around, reacting to problems as they pop up? Or is it actually building systems to prevent those problems from happening in the first place? This difference between reacting and preparing, well, that's exactly what we're going to break down. You know, the real backbone of healthcare in India are the mid-sized hospitals. They fill a huge, critical gap. But here's the problem. So many of them are trapped in what we're calling the constant firefight. It's this endless cycle of just reacting to problems, and it really affects everyone, from patients to staff. Okay, so think of these challenges as the fuel that keeps the fire burning. You've got limited budgets, a culture of only fixing things after they break, data that's all over the place, and really inconsistent standards. Each one of these things just makes that fire burn hotter and forces these hospitals to stay in constant crisis mode. And what you get is this really vicious cycle. A problem pops up, so a quick Band-Aid fix is slapped on. But because you never solve the root cause, that fix eventually fails. This just drains the already limited resources and leads to staff who are completely burned out and exhausted. It's really a recipe for poor patient safety and a system that just can't last. So, just how big is this quality gap we're talking about? Well, a program called Manyata took a look at private maternity hospitals, and what they found was shocking. Their baseline quality compliance was only 9%. Just let that sink in for a second. Before any help, only 9 out of 100 were meeting the required standards. But here's the amazing part. Here's the proof that real change is possible. After a structured, targeted program was put in place, that compliance number jumped from a tiny 9% all the way up to 80%. That is a monumental leap. Think about what that means. Countless safer births for mothers and their babies. It just goes to show that this kind of transformation isn't some fantasy. It's absolutely achievable. Now, that incredible 80% result didn't happen by accident. Nope. It was the result of a very deliberate shift in thinking, moving from that chaotic firefighting to smart fireproofing. And the big idea behind this whole shift is something called continuous quality improvement, or CQI for short. CQI isn't just another corporate buzzword. It's a completely different way of looking at things. It's all about creating proactive strategies to stop errors before they even happen, constantly fine-tuning how things are done, and using data to make systematic improvements to patient care. It really is the perfect antidote to that reactive culture we talked about. And here's the difference in a nutshell. On the one hand, you have firefighting. It's chaotic, it's short-term, and you're only dealing with problems after they've already caused damage. On the other hand, you have fireproofing. It's systematic, it's long-term, and it's all about preventing those problems from ever starting. The goal for any hospital is to make that journey from the chaos on the left to the stability on the right. Okay, so this proactive approach sounds great, right? But how does a hospital actually do it? Where do they start? Well, the good news is there's a whole toolkit of proven frameworks out there that are designed to guide them on this exact journey. Let's quickly look at 4 of these key tools. First, there's NQAS. Think of it like a detailed roadmap, especially for public hospitals, giving them a clear path to follow. Then you have POCQI, which is all about empowering the frontline staff, the doctors and nurses, to spot issues and test out small, quick improvements themselves. QALIPS is different. It focuses on leadership and culture, making sure that the commitment to quality starts at the very top. And finally, there's DMAIC. This one is like a detective's toolkit, using deep data analysis to solve those really complex, stubborn problems. See, there's a different tool for every kind of job. All right, so knowing about the tools is one thing, but actually using them effectively is a whole other ballgame. So now we're going to shift from the what to the how. Let's look at the concrete steps for making these improvements a reality, right there on the hospital floor. And listen, this isn't just theory. These frameworks get real-world results. We already saw how the Manyata program took compliance up to 80%. In Haryana, they used DMAIC to seriously cut down on infection rates. And various POCQI projects have led directly to better care for newborns. The evidence is pretty clear. These methods actually work. So, what's the game plan? It really boils down to 4 key moves. Number 1, build a dedicated quality team with people from all different departments. 2, you have to monitor progress obsessively with clear dashboards and goals. 3, get the hospital leadership to champion this mission visibly and relentlessly. And 4, use modern digital tools to make it all work smoothly. It's a clear, actionable path forward. Of course, it's not always going to be a smooth ride. There will be roadblocks. Your staff might resist change, money and resources can be tight, and your data might be a mess. But for every one of these challenges, there's a practical solution. You can beat resistance by starting with small pilot projects and showing off some quick wins. You can manage tight resources by focusing on the most critical problems first. These aren't deal breakers. They're just hurdles you need to plan for. And this proactive approach is really just the beginning. The future of healthcare quality is already taking shape, and it's being driven by some powerful new technologies and totally new expectations. What we're seeing now is AI starting to predict risks before they even turn into problems. We're seeing governments begin to tie hospital funding directly to quality, meaning better care literally pays off. But maybe most importantly, the whole focus is shifting away from just checking boxes on a checklist to fundamentally changing a hospital's entire culture to be proactive about keeping patients safe. And that really brings us to the final, most important takeaway. It's no longer a question of if hospitals can do this. We've seen the tools, we've seen the evidence, we know they can. The only question left is about will. It comes down to a commitment to a new culture of constant improvement, to building a safer, healthier future for everyone in India. Thanks for joining us for this explainer.